Good afternoon. My name is Tilghman-Bryant, and I am a Strategic Initiative Manager at C-Change, and will be serving as the moderator for today's webinar titled "E-Quit: An Introduction to Web-Based Smoking Cessation Resources." This webinar is being brought to you by C-Change and Legacy and has been endorsed by the Comprehensive Cancer Control National Partnership and supports the partnership's ongoing work to further the comprehensive cancer control movement in states, tribes, tribal organizations, Pacific Island jurisdictions, and territories. I would like to start by sending a special thank you to Legacy and Susan G. Komen for the Care for their ongoing support of C-Change's work in comprehensive cancer control. This webinar is the first in a series of 3 webinars focusing on cancer risk reduction. Today's webinar will focus on cessation science, practice, and resources. The next 2 webinars will occur during the first quarter of 2013 and will focus on tobacco policy issues and obesity. Today's webinar will provide you with information on the current state of cessation science and practice presented by Dr. Richard Hurt from the Mayo Clinic, an overview of online cessation resources, and particularly becomeanx.org, presented by Bill Formansky of Legacy, and ways coalitions can incorporate becomeanx.org into their cessation efforts, presented by Rebecca Carl, also from Legacy. Additionally, in an effort to add an interactive element, there will be 3 poll questions that will appear at various points in the webinar for participants to answer. We encourage you to participate and contribute responses to the questions posed. Lastly, today's Q&A session will not be a live session. Instead, participants joining via computers have the ability to type a question they would like to ask the presenters using the questions function on their screen. These questions will then be posed to the presenters during the Q&A session. We will attempt to get as many questions answered as time permits. However, questions that are not answered will be sent to the presenters to be answered after the webinar and posted along with the archived webinar to the C-Change website. Participants joining via phone will not have the ability to pose questions, so we highly encourage you to join the webinar online. I would now like to introduce today's first presenter, Dr. Richard Hurt, Professor of Medicine at the Mayo Clinic. Dr. Hurt's research focuses on tobacco dependence and improving treatment for smokers, and has led to pharmacologic interventions that are considered to be at the cutting edge of this field. Most recently, he has led an international initiative, Global Bridges, to train healthcare professionals in treating tobacco dependence and advocating for tobacco policy change. Dr. Hurt's work and that of the Nicotine Dependence Center team at the Mayo Clinic has significantly impacted the lives of tens of thousands of patients. I will now turn it over to Dr. Hurt to begin his presentation.
Good afternoon, everyone. It's a pleasure to be here. It's amazing always to see the technology and how it works. So hopefully things are going to go well today. I think they will. So this is who I am. I'm a professor of medicine. I'm a general internist at Mayo Clinic. I'm in Rochester, Minnesota. And we have been treating tobacco dependence for over 25 years. In fact, in 2013 will be the 25th anniversary of the opening of our Nicotine Dependence Center, which focuses on treating tobacco dependence for the serious medical problem that it is. And to date, we have treated over 5,000 patients in various levels of treatment, all the way from face-to-face counseling to bedside counseling for people in the hospital, to a residential treatment program which we have for people with severe tobacco dependence. They're admitted to a special residential unit for 8 days of treatment. We run that program about once a month. So as you can tell from those types of treatment services, we're into treatment in a big way. But I wanted to kind of step back and tell you why I think treatment is so important. So if we go to the first slide, Bill, the per capita consumption of cigarettes is not something that has been much known amongst people. My great-grandparents did not have to contend with cigarettes because cigarettes were not a product until the early part of the 20th century. And Camels on this display were the first modern cigarette. And they coupled the first modern cigarette, a new blend of 3 different types of tobacco, with an ad campaign the likes of which the world had never seen. So the next clip shows the camel ads as they became prominent. So the camels are coming, they didn't say what the camels were, and then all of a sudden the camels are here. Next click, please. And then 30 or 40 years later, the bad things begin to happen, because we know that for cigarettes there's a latent period between the time a person starts smoking and the development of disease, and there's a latent period between the time a society begins to smoke and the lung cancer and heart disease begin to occur. So that began in the 1950s, and then they changed. They added filters to the cigarettes. Winston was the first one. And then in 1964, the first Surgeon General report was written, really establishing clearly that cigarettes were related to lung cancer, heart disease, and emphysema. And after that, the consumption of cigarettes has gone down steadily over the years. They changed again. They now marketed light cigarettes as if they had made something new and it was a safer product. But the reality is light cigarettes were not different. And in fact, the tobacco in a Marlboro Red is the same as the tobacco in a Marlboro Gold. The first Surgeon General report on secondhand smoke was written and published in 1986. The second one, or most recent one, was published in 2006. And so we now know a lot more about secondhand smoke than we ever did before. And just to remind us that within 1 century, within a 75-year period of time, Camels, the first modern cigarette, had its 75th birthday. In Minnesota, we had a tobacco trial in 1998. I was the first witness in the Minnesota trial, and it was the first trial really to hold the cigarette industry accountable, and out of it came documents that reveal what they knew, when they knew it, and what they did about it, and the story is a pretty sordid tale. The good news for us is that cigarette consumption is on, but we still have over 43 smokers in the United States, so the problem on what way. So the next slide, putting this all into perspective. Vietnam War, car accidents. One more click shows the annual deaths of diseases. Almost 500,000 die of tobacco smoke. For every 8 smokers who dies of a cigarette-caused disease, 1 innocent bystander, often a child, dies from secondhand smoke exposure. Now, what's that the equivalent of? That's the equivalent of not 1, not 2, but 3 fully loaded 747s crashing daily, 365 days a year with no survivors. That's how big a problem that this is. Next slide. So in real terms, in costs, other than death, it costs a lot of money in health care. It also costs a lot of money in lost productivity. It also affects other things, the resale value of your car, your house. It increases car insurance, life insurance, and to some extent health insurance. More health insurers are doing that. And so we talk a lot about what's going to happen in the 21st century. We lost 100 million souls in the 20th century. If we do nothing different in the 21st century, we will lose 1 billion people. So this shows Peto's work going for the trend of cumulative mortality through the year 2050, showing basically 500 million people are going to die. The next slide shows what happens when we reduce uptake in starters by half. So this is what happens when we do very good prevention efforts. It bends the curve, but it takes it a long time to bend. And we need to do prevention, and prevention is very important. But the next click shows what happens if we were to have the number of adult smokers by the year 2020. We would bend the curve even more. So between the two effects, prevention and helping adult smokers to stop smoking, we could have a serious and very large impact on the deaths from cigarette smoking into the 21st century. So what is it about cigarettes that causes all the problems? Cigarettes contain over 7,000 chemicals, over 60 known carcinogens. It is the most elegant delivery form for a drug that's ever been invented. It gets it to the brain faster than shooting it intravenously. And the cigarette manufacturers continue to modify their products so that it does one thing and one thing only, and that it gets the nicotine to the brain of your child or your grandchild or to the addicted smoker as quickly as possible. Somehow, these high doses of nicotine cause upregulation of the nicotinic receptors in the brain, and that's a real biological change that in the addicted smoker means that they have a hard time stopping smoking because of the neurobiology. But all people are not alike. You've probably known someone who tried smoking when they're younger, never became a smoker. You all know someone who became an addicted smoker. So those are two different genotypes. And everyone knows an Uncle Charlie. Uncle Charlie couldn't hold a job, was married 5 or 6 times, smoked a pack of cigarettes for 30 days, and then decided to stop smoking, and he did. He didn't require any treatment, didn't have any withdrawal symptoms, so he's very different. And then the social smokers drive every addicted smoker crazy. So we're talking about the smokers who are addicted smokers, and if left untreated, those smokers, 60% will die from a tobacco-caused disease. So we think about how the nicotine works in the brain. Cigarette smoking on the left panel shows the arterial concentrations of nicotine that occur from smoking a cigarette. And on the right panel is the same depiction of crack cocaine. Crack cocaine is more addicting than snorting it because of the mode of delivery, just like inhaling nicotine from a cigarette is more addicting than putting a nicotine on like a nicotine patch. And the next slide shows what happens in the brain. The upper panel is the autopsy specimen of a non-smoker stained for the nicotinic acetylcholine receptor. And the bottom panel shows the same brain section stained for the nicotinic acetylcholine receptor in a smoker. And it shows that they have billions more of these nicotinic receptors. And that's why it is so difficult for some people to stop smoking compared to others. So as I've already mentioned, we treat tobacco dependence for the serious medical problem that it is, and we do it in a variety of different ways. We give counseling, supportive counseling using the technique of motivational interviewing plus pharmacotherapy. But we also know that the doses we use may have to be higher. Higher nicotine patch doses are necessary for some people. Combinations work better than monotherapy, and longer treatment is better. This is not a strep throat. This is not a urinary tract infection. So some people are going to need to be on treatment for many months, if not for over a year. So what do we use for our guides? Well, the first thing we use is the U.S. Public Health Service guideline, which is updated periodically and is based on the best evidence to date. We also combine our treatment with the concept and philosophy of behavioral treatment, addictions treatment, pharmacologic treatment, and relapse prevention. Those are kind of the hallmarks that we do. We also emphasize the neurobiology of this so that the addicted smoker who has a very low self-esteem can understand that it's not just a matter of willpower. This is a biological problem that they need to have more than just willpower to get over it. We also use the medical encounter, such as a hospitalization or a medical encounter in the clinic, as a teachable moment. And what we know about this is the more severe the medical problem, the more teachable the moment. So if a person's admitted to the hospital with a myocardial infarction, then they're more likely to stop smoking than if they came in just for a routine examination. We use as adjuncts to our face-to-face personal treatment telephone quit lines. We know that they work. There are web-based programs, and the one you're going to hear about today is Become an X, and we help develop the clinical material for that. Social media is being used more, and the evidence for its efficacy is increasing. So we need to use all things, but we also need to use good public policy. And as you know, the two things that tobacco companies hate more than everything else are increasing the price and smoke-free workplaces, because those two things lower the rate of smoking in people who continue to smoke, increase the chances of a smoker stopping smoking, and decrease the chances of your child or grandchild ever to start smoking. So when we have these effective policies in workplaces, if we have a 100% smoke-free or tobacco-free workplace policy, it does some very positive things. But we have a moral and ethical obligation as treaters to make treatment accessible for those people who are in those environments who are going to struggle with this. And so it's like any other thing in medicine. If we put restrictions on, we need to have good treatment available. And the guidelines would say that we need to have these health insurance with no copays for treatment in order to reduce the barrier, because we're dealing with an addictive disorder. And if we put treatment barriers up like payments, then people do not come as often as they need to. And by providing these interventions for workplaces throughout the country and improving their smoking rates by reducing those, we can improve their health, reduce absenteeism, we reduce healthcare utilization, and overall have a very positive effect on the overall outcome. So that's kind of a summary of where we are. As I mentioned, we treat this for the serious medical problem that is with a range of treatment services. And I think as we have good policy for good prevention and also for good smoke-free policies and good tax policies, when those smokers want to stop smoking, we need to provide them with the treatment services available to make it so that they can stop smoking without as much difficulty as they would have if they did it on their own. Thank you very much.
Thank you, Dr. Hurt. I would now like to introduce Bill Formansky, Senior Vice President for Collaboration and Outreach for Legacy, who will introduce our first poll and then proceed with providing an overview of online tobacco cessation resources, and particularly the becomingx.org site. Bill?
Thank you, Tasha. Hello, everybody. We're going to ask you a question and see what you think. We're going to put on the screen our first poll question of this webinar, and you'll see it on the screen in just a sec. And you can respond by checking one of the bullets there to the left of the items. The question is, how high of a priority is smoking cessation currently or for 2013 for your CCC coalition or organization? So please vote now. We'll give you 30 seconds or so to vote, and we'll see what the results are in just a sec. All right, just a couple more seconds for voting. Okay, everyone, last chance, and we're going to close the poll and see what the result is. All right, so that's fantastic news that a clear majority consider smoking cessation a priority, and in fact a high or top priority for a lot of you there. Thank you for voting. We'll have another question in a few minutes, and we certainly hope that this presentation today either helps you maintain smoking cessation as a priority, or if it's in the plan but not in action, maybe we can help you put it into action. All right, we're going to move on to the next part of the presentation, and I am pleased to be the presenter. So we know what works for tobacco dependence treatment: behavioral counseling, tobacco dependence medications, advice from a doctor, as well as increasing cigarette excise taxes and creating smoke-free spaces. But the rise of technology over the past decade or so has led to an array of quit smoking options on computers, websites, mobile phones, and smartphone applications. So in this dizzying array of new and newer media, what do we know about what works to help smokers quit? Many agree that the web is potentially an important tool to increase smoking cessation. Benefits include the convenience of anytime, anywhere access, the option for anonymity, opportunity for assisting a large number of people cost effectively, and the pairing of a web support option with established evidence-based interventions. Unfortunately, there's limited evidence to suggest that there's a long-term benefit to web support for smoking cessation. And this is according to the Cochrane Collection Review. It was updated earlier this year and included 20 trials with studies published as recently as 2010. This is part is because of the wide variety of studies and varying rigor and design. The Cochrane authors concluded that more evidence is needed to determine if programs delivered over the internet can help people stop smoking. While the evidence is limited, some of what we can glean is that individually tailored information and support may be more effective than a static website, that the internet may have additional benefit when used alongside other interventions, that web-based support may be more attractive to young people and females who smoke, and could possibly result in increased utilization and satisfaction. We still have some to learn on web-based support. The news is more positive for interventions via mobile phones. In fact, a review was released just last month that included evidence from 5 studies finding that interventions delivered by mobile phones can help people stop smoking. Results varied from individual studies, but the successful interventions mainly used text messaging to provide motivation, support, and tips for quitting. It is worth noting that there are no published studies on smartphone applications designed to help people stop smoking were reviewed. So let me ask you a question. Do you know what is a good reason to stop smoking? What would you say? For more than 4 decades, the public health community has been giving smokers good reasons not to smoke. From the devastating health consequences, to the impact of secondhand smoke on loved ones, to the simple fact that smoking can be gross. And that's not to mention the toll it takes on a smoker's wallet. When Legacy started talking to smokers about quitting and what would motivate them, they told us they knew all about the reasons not to smoke. That insight that smokers knew why but wanted to know how led us to think hard about how to give smokers a life without cigarettes. Our approach was developed by Legacy and its ad agency Idea City along with Mayo Clinic through multiple phases of formative testing, including qualitative and quantitative work with both current and former smokers. Instead of being preached to, smokers were seeking realistic and honest advice from a trusted source on how they could succeed. The website, then, is a largely evidence-based information presented in the voice or brand of X that reflects those ideas. And the result is a new way to think about quitting and the concept of relearning life without cigarettes. So I'm pleased to introduce to you becomeanx.org. Let me give you a little bit more history. The becomeanx.org site was developed by Legacy in partnership with Mayo Clinic's Nicotine Dependence Center beginning around 2005. The site has evolved greatly from its first iteration and continues to grow. But it was initially conceived as a complement to a branded national media campaign focused on the idea of X. Initially, the site was promoted through paid advertisements and public service announcements. More recently, public relations and partnerships, along with online ads, have been the focus. Since the site's official launch in April 2008, more than 3 million people have visited the site, and nearly 600,000 people have become registered users. So let me talk next about the X Plan, which is the heart of becomeanx.org and the core of the idea to relearn life without cigarettes. The X Plan is embedded in the How to Quit Smoking section of the X website, and it has 3 parts. The first part is Relearn Habit, where smokers study their smoking patterns, identify triggers, and break the glue between the trigger and the cigarette. A cornerstone of X is smoking triggers and the idea that smokers are more likely to succeed if they break down quitting into smaller, manageable parts. This is accomplished through a cigarette tracker tool and fun animations to help smokers think about beating their smoking triggers. The site includes 18 triggers, everything from drinking coffee to driving a car or being stressed. And X gives specific suggestions, prompts users to identify what they will do instead of smoking, and encourages practice separating triggers from lighting up. The next part of the X Plan is Relearn Addiction. This part of the plan provides information on how smoking changes a smoker's brain chemistry and how medications can double chance of success. This section features Dr. Hurt, who spoke earlier on this call, and he provides expert advice in terms a smoker can understand. The overarching message in this part of the plan is the importance of talking to your doctor and maintaining adherence to tobacco dependence medication. The third part of the X Plan is Relearn Support. X encourages smokers to reach out and surround themselves with the right support so they can increase their chances of quitting. X addresses talking to friends and family about a smoker's plan to quit and lays out possible scenarios for conversations, as well as listing other options for support. Now that I've explained the 3 parts of the X Plan, I want to highlight some of the other features of becomeanx.org. We will briefly walk through each of these to demonstrate how X brings quitting smoking to life. The features are embedded throughout the site in each step of the quitting process. becomeanx.org is jam-packed with expert advice information, and resources, but in a way that attempts not to overwhelm. We begin with breaking down quitting smoking into smaller, achievable tasks. How to quit is the first step and describes the X plan. Step 2, quit smoking, focuses on what to do before and after you quit. Step 3, stay and quit, is designed to help a smoker achieve success. Another feature of the site are video clips. These short videos break down complicated information, like how nicotine impacts your brain. The Relearning Addiction page includes 10 short videos featuring Dr. Hurd as host narrator. Topics covered in the videos include your brain and nicotine and choosing a medication. A third feature I want to highlight today is advice that is presented through short text and icons. For instance, X covers how to deal with cravings and alerts users to warning signals that they might light up. Users of the site have access to information like the benefits and rewards of staying quit, ideas on how to relieve stress, and tips on how to limit the weight gain associated with quitting. Another feature worth noting is that X includes advice, typically through short videos from former smokers. These X experts provide real-life insights and guidance and bring an important I've been there, done that, or I've been there and I understand perspective that does not sugarcoat the reality of quitting. We wanted to give smokers what they told us they wanted, honest, matter-of-fact information from someone who's been there. And Jason and Tanya are 2 ex-smokers who provide just that. Next, I want to talk about some of the interactive exercises on the site. The first is the cigarette tracker that you'll see here in a second. We believe that quitting successfully begins with a smoker understanding what his or her personal smoking triggers are. The cigarette tracker is built into the Relearn Habit section and allows the user to capture smoking triggers, the time of day, and how strong an urge level they felt to smoke that cigarette. Another interactive exercise is the separation exercise, which is also included in the Relearn Habits section. This exercise is designed to guide a smoker through separating the act of smoking a cigarette with the habit or trigger associated with it, and help a smoker to practice doing it before he or she really quits smoking. And another interactive exercise that I want to show you is the third example, which helps a smoker think through who might be a champion when he or she needs one. This exercise provides a place where a smoker can enter the names of friends or family whom they can count on for support at home or work. In order to get the most out of these exercises, a smoker is required to complete a free site registration. This allows the website to save information that's entered. Another feature is My Quit Plan. It's one way a smoker can personalize his or her X experience. In order to personalize the site, as in the interactive exercises we just saw, free registration is required so the site can save user data. My Quit Plan includes an online calendar where a registered smoker can add his or her quit date. Once input, a smoker will receive emails from X that can help them prepare for their quit date and tell them what to do on the day they quit. X will also check in via email a few days or weeks after to see how the quit is going. My Quit Plan also includes a checklist that helps the smoker track step by step as they complete the interactive exercises and set a quit date. Or a smoker could start at the My Quit Plan page and use the checklist as a starting point. Anecdotally, users have told us that they like the online checklist and the progress bar on the Quit Plan, which helps them track their own progress. Another way a registered user can personalize his or her X experience is the community, which I will cover next. If the X plan is the heart of becomeanx.org, the X community might just be its lungs. This is a critical section that provides individuals a place to connect with others, to ask questions, exchange experiences, and share support. There are multiple ways to engage in the X community, which is monitored by Legacy and Mayo Clinic staff. One way is the My Profile, which allows individuals to share information about themselves and tailor their page with a photo, sort of like Facebook. Like blogs across the internet, this part of the X community allows users to speak their mind and share what they're thinking or how they're feeling with others. Groups are essentially affinity clubs that individuals can join or create as a means to connect with others with a common interest. There are hundreds of groups on X. The majority were started organically by users. Groups range anywhere from a handful of individuals to more than 500 people. And affinities include geography like city and state or your quit date. Finally, the community features a forum, which includes Ask Dr. Hurt. But anyone on the site can begin a discussion topic and to which others can post replies. This is a place to find expert information that may not be included on the site or timely and topical updates. Through the community, smokers find support from other smokers that is available 24 hours, 7 days a week. And in fact, you don't have to be registered to explore the community, so you're welcome to go in and check out some of the postings and some of the comments. My time is running short, so I want to close with some final thoughts on X and some of the other quit smoking resources you may not be aware of. While I did not have time today to cover all of the content on the site, I did want to mention some of the other information a smoker could find, including a special section on lung cancer screening that includes short videos and content that can be downloaded, a printout library that includes an X-Quit manual in English and in Spanish in PDF formats that can be downloaded, and lists and links to other resources such as 1-800-QUIT-NOW, our partner Mayo Clinic, and free information from sites like American Cancer Society or American Lung Association, as well as a comprehensive listing of each state's telephone counseling number and its quit smoking website. Sites you might not find on X include Be Tobacco Free, which was launched last month by the Department of Health and Human Services. This site provides one-stop access to information from across federal agencies like CDC, FDA, NIH, and the Surgeon General. The National Cancer Institute maintains www.smokefree.gov as well as smoke-free text, both worthy of checking out. The American Lung Association offers its online Freedom from Smoking program for a fee. And there are a number of corporate wellness offerings through groups like Quit for Life from American Cancer Society and Alere Wellbeing, quitnet.com, and Text to Quit. I want to thank you for listening, and I know I had to rush through those. I had a lot of information to share, but I hope that you were able to benefit, and we are going to continue now with our next poll. So we're going to bring up the next poll, folks. It's your turn to vote, and this is sort of no pressure, but the question is, now that everyone has received an overview of the becomeanx.org site and key features, we'd like to know to what extent do you agree that becomeanx.org presents a new way to think about quitting? You choose the bullet next to the options, and you'll have about 30 seconds to vote. All right, just a few more seconds to vote. Please get your vote in. I won't be offended either way. All right, one more second and we're going to close the poll and find the results. Thank you. That's great news. We're glad that you feel that way, and we really did put a lot of time and effort into developing the site, and it feels good to see that folks, after hearing the presentation, feel pretty either somewhat or strongly agree that X does present quitting in a new way. So we thank you for your response to that poll, and we are going to continue with my colleague Rebecca Carl, who's Senior Manager for Collaboration and Outreach. She's going to provide some specific examples of ways that coalitions can use becomeanx.org to promote smoking cessation.
Great, thanks a lot, Bill. As Bill said, I'm going to elaborate on some ways that you all can adopt X as your go-to online cessation resource. One easy first way is to post the X badge, which, as you'll see here, includes the logo and a live link. And you can post this on your website or on your blog, or consider including X to your list of online resources. There are 3 versions of the X badge, a shorter or longer version, and you can find them on both the Become an X and Legacy sites. Another implementation idea is we've developed an X wallet card that you can see here at the bottom. Organizations can request up to 5,000 X wallet cards through our easy online ordering system. Groups have used these wallet cards for outreach to cessation classes, giving them out to bar and club owners, to Healthy Start participants, university health services staff, workplace wellness programs, medical dental students. So that's just a sampling of some of the potential, what the potential reach is of the wallet cards. We've also developed a tear-off flyer and a small poster. The tear-off flyer, which is on the left, is an 8.5 by 11 printable document that can be easily posted in public spaces like a community center or a healthcare facility or an employee break room. And then on the right is a small poster that can also be easily downloadable and printable. And there's 2 size options for that, 8.5 by 11 or 11 by 17. So those are 2 options. Also, here what you're seeing is an ad that we recently developed in collaboration with a local partner group. We developed this ad for use in the mining community in West Virginia, and this ad will be shown in the changing area on internal monitors during quit season and into the new year to support quit attempts. Another option to keep in mind is that we're happy to offer X content for newsletters. This here is an example of an X article that we developed for the Asthma and Allergy Foundation of America. This article was featured in last year's fall holiday quarterly newsletter, and we also regularly send articles out to various partner organizations for inclusion in their e-newsletters, their listservs, and for email alerts to their membership. So that's another thing to keep in mind. Another option, feeding on something that Bill mentioned, the online X community. You can also create an online X group tailored to your community. There are many customized support groups in the X online community. We'll be happy to help you to create a support group for your partners and coalitions. Another option is liking us on Facebook, or also connecting with us via Twitter. And some other ways that we could support your efforts in terms of integrating X is we're happy to work with you to host an intro X webinar for your partners and stakeholders. For example, we've done this in the past. We've presented to the network of Mid-Atlantic Regional Kidney Dialysis Centers. Another option is a Train the Trainer session to educate staff about X and about the X Quit plan. Also, keep in mind, we encourage you to keep in mind your local cessation groups and programs in hospitals and in communities, reaching out to them and telling them about X as a resource. Also, keep X in mind in terms of content for wellness materials and healthcare provider trainings. We recently worked with the Wellness Council of Indiana and the Indiana Chamber of Commerce. They reached out to us and they actually found the X site and found that the X messaging really resonated with them, and ultimately they decided to include X content in an online cessation and tobacco policy tool that they were developing for HR professionals to be promoted across their state of Indiana. So we were happy about that. So as you can see, there are many opportunities to integrate and utilize X as a cessation resource, and I encourage you to spend some time on the Become an X site and explore other ways that X could be a useful tool for you and your partners. And please feel free to contact me or Bill for any questions, or if you want to discuss any of the ideas for utilizing X. And there's my email address. You can reach me. Thank you very much.
Thanks, Rebecca. We've now come to the portion of the webinar where we will have a Q&A session. The Q&A session will last approximately 10 minutes, and this will not be a live Q&A session. So if you have a question to pose to any of the presenters, please use the questions feature on your screen to enter a question for either of the presenters. So the first question we have is, what is the cost to smokers for the becomeanx.org website? Bill, Rebecca, can you please answer that one?
Absolutely. And my bad for not saying it, it's absolutely free. There is no cost at all for the website. There's no charge. We do ask that users register so they can take advantage of all the different features and the site can save their information, but there's no cost at all to checking out the site or registering.
The second question is for Dr. Hurt. Participants said that they don't understand the temporal cortex slide. What was this slide showing?
The slide shows, these are autopsy specimens from a study to see what the brain, how the brain reacted in smokers versus non-smokers with the nicotinic acetylcholine receptor. That receptor is the one that's responsible for tobacco dependence or nicotine dependence. And the upper panel of that slide, I don't know if, Bill, you want to put it back up if you can. The upper panel of that slide is the brain of a non-smoker stained with special histochemical stains for the nicotinic acetylcholine receptor. All of us have these receptors in our brain, but smokers, because these receptors get upregulated, have billions more of them than a non-smoker does. So the way I explain this to patients is that the high concentrations of nicotine from smoking causes these receptors to increase in number, so that if you have a smoker in front of you and that smoker had an identical twin, same DNA, same makeup, and that person's a non-smoker, if we did brain biopsies on those two individuals, the smoker would have billions more of these receptors than the non-smoker. Why is that important? It's important because if those receptors do not continue to get the hit of nicotine from cigarettes that they're normally getting, then withdrawal symptoms occur and the urges to smoke occur. So that's the neurobiological basis for nicotine dependence or nicotine addiction.
Thank you, Dr. Hurt. The next question is for Bill and Rebecca. Do you have resources for individuals who have been smoking for 40 to 50 years? Are any of your featured former smokers older or with a longer smoking history?
I don't believe we have any specific resources for older smokers, and I could check later, but there may be a community or a group on the community site that actually is a group of older smokers that are supporting each other. But the site and techniques on the site are generally evidence-based and theoretically would work for any smoker. Obviously, it's important to follow through each of the steps of the X plan, including the counseling, the medications, and whatever social support. I don't know if Dr. Hurt has any information on addressing older smokers that you might be able to share.
Well, certainly the clinical material that we provided in the design of the Become an X site is generic in the sense that it applies to all age groups. Some of the things on the site do focus on younger people, but most of the things that we put in that have clinical relevance, that are evidence-based, are for people of all age groups that are heavy smokers, light smokers, and the treatment. In fact, if you look at the site and look at how we talk about nicotine replacement therapy, we base that on the number of cigarettes smoked per day to help the person get the right dose. We use combinations. So we basically put on the site what we do in our clinical program, and so we treat each individual for the individual that they are, because all smokers are not alike.
Okay. Thank you. For legacy, related to the X, are there any apps or widgets that individuals can use in combination with this website?
There's the smoking badge that Rebecca mentioned. We also have an X application that's available on the Apple Store. I don't know if it's available on the Android store, but we can check and follow up with everyone. It is 99 cents, and it includes some of the content from the website. Rebecca also mentioned that we have a Twitter feed and a Facebook page, and each of those, if you sign up, send supportive messages to smokers at different intervals, sometimes daily.
Thanks, Bill. Dr. Hurt, are there any national resources for assistance purchasing cessation resources, over-the-counter and/or prescription?
I'm not sure I understand the question, but the different state quit lines will have available to them for free. Some of them do for free nicotine replacement therapy. And those are also over the counter, except for the nicotine nasal spray and the nicotine inhaler, which are both prescription items. So the nicotine patches, lozenges, and nicotine gum are all over the counter. The others are all by prescription, so they're not something to be available through a website or through a telephone quit line. I don't know if that answers the question or not.
I'm going to pose this to both Legacy as well as Dr. Hurt. One participant asks, we have an overwhelming amount of chewers in our community. Do these principles still apply to chewing individuals, or is there something different for them?
Well, I'll start out and then Bill can chime in, because chewers, it really is a different behavior than smokers. We do have some things, some of the blogs we talk about on the website talk about chewers. We know less about chewers than we do smokers, and so there's less science out there about what we can do. But we use basically the same behavioral techniques through motivational interviewing and pharmacotherapy for people who are chewers, just like we do for smokers. And we do the same thing for pipe smokers and cigar smokers. So we just know less about them than we do about cigarette smokers. Now, that said, there's an increasing number of chewers who also continue to smoke cigarettes, and so that's becoming a real challenge because of the dual use. They chew when they can't smoke, and they smoke when they can. And so there are a growing number of people that are doing exactly that, and so we're going to have to be more creative in how we deal with that.
Bill, do you want to contribute to the answer?
I would just agree with Dr. Hurt. There's no specific content built into the website for spit or chew tobacco users, although we do have some content on the community. And I do believe we have some resources that we can post after the website where people can get some assistance if they specifically have concerns with spit or chew tobacco.
Thank you. And I want to remind all participants that this webinar will be archived, as well as if there are any questions that go unanswered, we will pose those to Dr. Hurt, Bill, and Rebecca, and they'll be posted along with the archived webinar on the C-Change website. We have another question for Legacy related to X. Is this website helpful for someone who has already quit? Can they, yes, that's the question. Is this website helpful for someone who has already quit? Bill or Rebecca?
We're happy to answer that. Just to go back to the app question, if you are looking for the X app, it's called the X Plan, and it's available for the iPhone, the iPad, and the iPod. If you type in the X Plan, it'll help you find it. Our theory on the website, on the becomeanx.org site, is that it's a place that a smoker can come back to again and again, so you never finish becoming an X. And so the community reinforces people who have either used the site to quit or have joined the site afterwards to maintain their quit. Our Stay and Quit section has resources and tips, so I think it could be very useful to someone who's quit and wants to maintain quit. There's a fun little, it's fun for me but not for smokers, a little button called the panic button. So if someone's feeling an urge and want to be distracted or want to get some information, they can click on that panic button on the site and get some help. So I do think there are aspects of the site that might be useful to former smokers who still get those cravings from time to time.
Yeah, I'd just like to add to that when we built the clinical part of this, we know we can help people stop smoking the real key to the future is preventing relapse. And so maintaining that abstinence from smoking is present throughout the website in the clinical part of it, and those communities where people do get together and they can get support for their continued abstinence from smoking is really a key element for a lot of people. So I think the answer to the question is yes, there are elements there that are beneficial to people who've stopped smoking, because again, stopping smoking is a process. It doesn't just happen all at one instance or all at one time, and so most people have to work on this over a long period of time before they're stable in their abstinence from smoking.
Thank you. The next question is for Legacy as well. Had this Become an X.org been tried in rural health communities?
I don't know of any specific data about rural health communities, although I do know we receive a number of orders for the X wallet cards that Rebecca talked about to be distributed in rural communities. As long as you have access to a website or web service, you can access the website. And I know we've had states from across the country use it or partner on the site, but I don't have any data specifically around use in rural communities. We are preparing to publish early next year an evaluation of the site that will provide some more details on success rates and some of the findings we have related to users successfully quitting on the site.
Thanks, Bill. Another question for Legacy. A participant asked, if we do not smoke but want to experience the site for our organization, is there a way to do that?
Absolutely, anyone can go on the site. If you choose to go on the site and register, I believe there are some options for people who don't smoke in terms of describing yourself. In fact, I think there's an option for clinicians. I don't know what some of the other options are off the top of my head, but you're welcome to go in and experience the site.
Yeah, there is a way to go on and register as either sort of a healthcare practitioner or friend of someone who's trying to smoke. Yeah. There are those different options. So you can go and register and explore and really kind of get a sense of what the quit plan is like and what the X experience is online. So feel free to do that. Please do.
And in fact, if you wanted to go on and start, say you wanted to start a group of people who are quitting, you have a local group and you wanted to use the site, you could be the one that goes in and establishes the group in the community and then invite people who are actually smokers to that community to give them a space to interact with one another.
Thanks, Bill. Another question, I'm going to pose this to both Bill and Rebecca and Dr. Hurt. Do any of you guys know of programming designed to utilize with adolescents or their suggested adaptations?
Well, maybe I can start with that. When you look at the U.S. Public Health Service guideline, which is the best evidence-based that we have, the things that seem to work and there's evidence for working in adolescents are the counseling parts that are given. Pharmacotherapy has not been shown to be of very much help in adolescents. So like cigar smokers, pipe smokers, and chewers, we know less about adolescents than we do about adult smokers. And the evidence that we have right now is that behavioral counseling is the thing that does work, and medications do not seem to work. I don't think we have had anything specifically designed for adolescents or teen smokers, but Bill or others from Legacy can answer that.
One thing I would add, Dr. Hurt, is I would recommend they go to smokefree.gov. The National Cancer Institute has established for teenagers a smoke-free texting program. And so I think you could find more information about that on smokefree.gov or betobaccofree.gov. If you search those sites, I think you might find that program. I don't know of many others. We certainly don't know a lot about what works for adolescents in terms of quitting smoking.
Okay, another question that came from a participant is, Is there any concern of quitting while pregnant in terms of withdrawal? Dr. Hurt?
No, actually there's a lot of urban mythology out there. There's a lot of misunderstanding, and even within the community of obstetrics and gynecology, we hear all the time, and the ATTUD listserv has just had a series of this, and those of you who don't know about ATTUD, the ATTUD is the Association for Treatment of Tobacco Use and Dependence, which is mainly counselors and other healthcare professionals who are involved in treating tobacco dependence. And just a month or so ago, there was a lot of chatter on the listserv about this very question. Some of the obstetricians have the misperception and mistaken idea that for their pregnant smokers, if they stop smoking, they can cause withdrawal in the fetus and cause harm. And that's just lunacy. I don't know any other way to say it than that. There's no evidence to that effect, and there's no evidence that stopping smoking causes any harm to the fetus. And in fact, it's just the opposite. Any pregnant smoker who is continuing to smoke causes harm to the fetus, increases the chances of preterm delivery, as well as a host of other things. So our obstetricians here and we in the Nicotine Dependence Center treat smokers who are pregnant very aggressively with medications and with counseling. And the only medication we don't use is varenicline. We use bupropion, we use nicotine patch therapy, we use short-acting NRT, along with behavioral counseling for the woman who has found out she's pregnant and is unable to stop smoking. Most women in this day and time, once they find out they're pregnant, will stop smoking. The problem that they have is that they relapse to smoking after the pregnancy is over and after they're delivered. So they need to be followed up and provided with treatment later. But the idea that stopping smoking causes some withdrawal symptom in the fetus or causes the fetus any harm is just not true.
Tasha, I would just add briefly, we have a page on becomeanx.org for pregnant smokers that addresses some of the issues and answers some of those questions that might be helpful.
Great. Thank you to all who posed questions during the Q&A session. We're going to have to move forward. Again, you can continue to enter questions in the question box, and we will consolidate those questions and pose them to the presenters and have them posted along with the archived webinar to C-Change website. Bill, I'm going to turn it over to you for the third polling question.
Thank you, Tasha. Everyone, please stick with us for another 2 or 3 minutes because we're going to ask you your opinion. We want to put up the last polling question of our webinar. How likely is your coalition or organization to use the resources presented during this webinar? You see the options on the screen. You get to select one, and in about 30 to 40 seconds, we'll know the results. All right, we're going to give you about 5 more seconds to enter your response, and then we'll see the results on screen. Very good. We're glad to see that you chose one of the top 3 responses, and really no one chose the bottom responses. Those are people who probably dropped off the call. But we're thrilled, and we really hope that this was a helpful presentation for you. And any of the presenters would certainly be willing to provide additional information or advice if you have it. Tasha, back to you.
Thanks, Bill. This concludes today's webinar. I would like to thank Dr. Hurt, Bill Formansky, and Rebecca Carl for presenting such valuable information, as well as to all of the participants who took the time to join us, respond to the polls, and ask thoughtful questions. As a reminder, this webinar will be archived and posted to the C-Change website, along with responses to questions not answered during the Q&A session. Immediately following this webinar, you will receive an email with the link to the evaluation for this webinar. We hope that you will take a few minutes to complete the evaluation, as your feedback will be used to help us tailor the content of the next webinar on tobacco policy issues, as well as future webinars to meet your needs. Thank you again to all for participating, and have a wonderful day.